My name is John Muffoletto, general surgeon living in Anchorage, Alaska for 28 years now. My background started in the University of Notre Dame. Becoming a caregiver, a doctor, or a surgeon, I think starts with service. And that is a big part of the Notre Dame mantra as far as service, giving back to the community, leadership. And those things all kind of fell into place as to where I wanted to be and what I wanted to do. As a general surgeon, that name implies knowing your entire patient. You really need to feel comfortable taking care of your patient from start to end. In the world of subspecialties, you rarely get to do that, but in my training, I did, and I found that very rewarding. I would like my patients to be heard, number one. I want my patients to know that when they're seeing me, I'm a surgeon that they can trust, and I'm a surgeon that will always have their best interest at hand. So it's kind of corny when you say that you always want to treat your patients like your family, but I do think that that's something that I've strived to do, and I think that's important for your patients to feel. In today's world, we're sometimes pushed to see a lot of patients in a brief period of time. That's sort of a recipe for disaster in most aspects of medicine. It can function well in some, but as a surgeon, when I see my patient, number one, it's just me, which is, other offices, they operate differently for good and bad. They have physician's assistants and nurse practitioners, which are fantastic. But my patients get to see only me from beginning to end. And I think they feel very comfortable with that. And as a surgeon, I strive to make sure that I know something about my patient and their medical history and what they've been through surgically before I even talk to them. So what you don't want as a patient is to see your surgeon come into the room and say, okay, how could I help you? That immediately to me is a put-off, right? So I come in and introduce myself, and then I give an immediate recap of their medical and surgical history. I put the time in to do that. They feel very comfortable. I know them already. I know the history of the problem. So now they're at ease. And I think people appreciate that.